I'm a perinatal specialist here at Broadlawns. I provide individual therapy for women who are either new moms or have been moms before. It's really important for moms to feel supported, and here at Broadlawns we take that so seriously because we know how hard it is, either if it's your first child or your sixth child. We try to support moms because maternal mental health is often missed.
First part of my pregnancy was really hard. I battled a lot of nausea and trying to keep up at work with that. And being a perfectionist at work, it was really hard to give what I needed to give. I was struggling at home with just even getting out of bed on my days off. And because I felt tired, I felt like I wasn't doing what I needed to do, just even doing the dishes or cooking, and just overwhelmed with depression and anxiety that I wasn't being who I was before. So I decided to reach out to Broadlawns with individual therapy first, and that's when I met Christine Young. And after seeing her, she told me about this pregnancy and postpartum group.
We are so fortunate here at Broadlawns to have certified perinatal mood disorder specialties. Myself and Dr. Kendra Perry both specialize in perinatal mood disorders, and we bring that specialty to our free postpartum support group. And we also are 2 of 7 in the state to have that certification. And this is something we uniquely bring to Broadlawns to help serve moms and create a comprehensive maternal mental health care.
So the first time I decided to go to the pregnancy and postpartum group, I was a little nervous. Being a nurse, you sometimes think that you should be perfect. So that was hard for me walking into it. But I needed help. I knew I did. I knew I couldn't do this alone. So I decided to go. I met some amazing girls, even brought a friend with me. And we shared stories. We talked about how we were just so overwhelmed. We just would cry and cry at home because even though our friends had experience having babies, it was hard to relate to them because they weren't currently pregnant. And just having that support and really reaching out with people from the postpartum group really helped. I didn't feel as alone, and they would tell me that they were struggling to get out of bed, they were struggling with taking a shower, and just would cry for no reason. So going to the postpartum group really put things in perspective and allowed me to really touch on, yes, you're human, everybody's going to make a mistake, but we're all doing the very best we can.
Once a family or a mom decides that she really wants to get some help, it's important to go seek out her primary care doc or her OB or midwife. And if they're not available, to use our Broadlawns psychiatric urgent care if necessary. That's a easy service to offer and just get immediate advice.
I was actually very nervous about having postpartum, and it was a big concern. And I had talked about it in postpartum group, what the plan would be, and I talked to my family about this is what needs to be recognized. If you see this, just tell me and I'll go, because sometimes you don't recognize it. Sometimes it's the family members who really see it. So it's important to have that supportive network around you, and also going to the pregnancy and postpartum group too, because they'll share their tidbit. They're honest.
It's really common for moms to experience what's called baby blues, which is about 80% of moms in the first 2 weeks after labor, because I don't know about you, but we're really overwhelmed and we're exhausted. But after that 2-week period, we then become a little bit more than just baby blues, and we need to seek out some support at that time. If mom is having some racing thoughts, sometimes she can become overwhelmed and will start to be really obsessive, and we need to get some help with helping her feel more supported and loved.
At first, I was super excited when I gave birth, and it was a miracle. Then I went home. Things were very overwhelming. I wouldn't say I had an immediate connection to her, like some women do. I'd say it really happened over the course of 3 months.
Something I want people to know when they're watching is that they're not alone. Perinatal mood disorders is treatable and temporary. Our free support group here at Broadlawns can be a first-line triage to help moms find what they need and get them help very quickly. This is one of the most common complications of childbirth, but does not given the attention that other medical conditions like preeclampsia and high blood pressure are given during pregnancy. However, it's still the most common complication of childbirth. If there's any question or concern with the way you feel right now, there's no wrong door to access our services here at Broadlawns. We're here to help, and we want you to feel like you're not alone.